Hi, my name is Alicia Truelove. I am a registered nurse of over 10 years. Currently, I'm located in Southern California. Um, a little bit of my background in nursing. I became an EMT in 2005, and from there, I moved into the nursing profession. I became an LVN, followed by my RN licensure. And my very first RN position was with a rural hospital located in the high desert of California. And now I'm here at Arrowhead Regional Medical Centre. We serve one of the largest counties in California. So yeah, I'm just happy to be here. Thank you for your time. As I mentioned, I began my career at a rural facility in the high desert of California. And you see a lot of different things in a rural setting, some of which is difficult to understand because you have to understand the dynamics of all of the healthcare issues in a rural area. So it's really important to understand the social impacts of policy. Those have a direct effect on rural communities. Often these rural facilities, these rural areas, they're left out of decision making when it comes to policy. So it's important to understand that because your patients are, they may be a little bit sicker than your average, or, you might see some complications that you may not have seen in nursing school that you have to really critically think. So, being a nurse in a rural facility is very, very rewarding. I've I've, seen things I had never seen in nursing school, working at a trauma hospital in a rural area. So, it's very, very rewarding. In rural areas, there are oftentimes a lack of providers for people to see. So, for example, with working and living in the high desert, uh, I I was having difficulty finding a physician that I would be able to see in a timely manner. So sometimes you're waiting months to see, your primary care physician. Uh, and that can often lead to issues with, with your disease process. You may not have the ability to see a provider right away in a rural area. So when that happens, people, they need care, they need help. So they present to the hospital and particularly the ER. So, our rural areas, they do see a lot of people in their ERs for things that can be addressed by a primary care physician. Also, being in San Bernardino County, we are one of the biggest counties in California. And with that, we have a lot of activities that other counties don't have. So for example, there's a lot of off-roading areas. It's very, very rural areas. Sometimes people go out, um, there's a lot of trauma injuries that occur. And, our hospital, Arrowhead Regional Medical Centre, is a trauma hospital. So we receive, all kinds of different patients from, like I said, an individual who may need just, lab work done, all the way to someone who maybe sustained an injury in an off-roading vehicle accident. So it is you just don't know what's going to walk through that door. And especially in a rural facility, it's unpredictable, but, you know, that's what helps you grow as a nurse and as a provider, as a clinician, to be experienced with all kinds of different people that may walk in that door. So I think one of the most challenging parts of being a nurse in a rural facility is understanding the dynamics of the facility, understanding that we may not have funding in the traditional sense of a private organization where they're privately funded. We are supported by the government, and sometimes that requires some creativity in budgeting, things like that, uh, which generally don't impact nurses at the bedside with that knowledge, but it does come into play when we talk about things like pay, competitive pay. Um, it becomes challenging when you discuss retention. Um, the fact that you are able to experience so much as a nurse at a rural facility and really practice under the extent of your licensure is something that attracted me to work at this critical access hospital. I wanted to challenge myself. So working at a rural hospital, some of the challenges that come are tied to finances. Other things I've noticed is they're the background of the people that we serve. um, it can be a little bit difficult to understand all of these social impacts on our people. So um, I find that a little bit difficult to navigate as well sometimes. Our hospital here, we are fully supported by the County of San Bernardino, and we are very fortunate that they provide resources from other departments within the county, such as the Department of Behavioral Health. They offer text lines and also phone lines for healthcare providers to call in if they're experiencing anything related to mental health. Our public health departments have been instrumental in providing care to our communities, with in hand with the hospital, specifically talking about vaccines. So all of the collaboration that happens within the county really supports the hospital, and the hospital supports the county as well by providing care to the community. So it's a great environment to work in, especially as a nurse, to understand all those dynamics as well. For me, getting the information and resources to the staff had proved very difficult during the pandemic. But I wanted to be involved in the process and, get that information to our staff. So I was elected to the bargaining team with our union. Our union is comprised up of, bedside nurses. So I was uh, elected to be involved with negotiating our contract, and that includes pay, that includes all of our benefits, uh, including nurse retention, strengthening that. So it was very important for me to be involved in that process. Um, I'm also a very strong advocate for digitization of information so it's easily accessible to our staff. So during the pandemic, I compiled many resources for our staff in the hopes of providing them digitally. But really, what was needed was us going to the units and answering questions, being there as a resource in person. So it was very interesting, during the pandemic to function as a nurse educator because there was so much changing, at that time. Yes, so during the pandemic, like every facility in the States at the time, we were struggling with the allocation of PPE. Uh, we were instructing our staff to properly reuse PPE, which goes against everything we've learned in nursing school. Um, Being able to just listen to the concerns of the nurses. So early on in the pandemic, you know, uh, the main issues were staffing, PPE. A lot of the staff felt that they were, left to provide care to patients without a lot of support. Um, some difficult things that we had to work through in our organization. Another thing that I did mention is, competitive pay. So that was something that the nurses were very adamant about. Um, and during our negotiations, that was one of the main concerns that they had was increasing their pay to be able to, work in this environment, but also just to, you know, survive, uh, while they were not at work. So those were some of the main issues that came up during the pandemic. Yes, so the county was very, very responsive in attempting to address the needs of the staff. So initially, after the negotiations, um, the issues came up. The county immediately addressed the issues to the best of their ability. Um, and with that, when it comes to disseminating that information to the staff, uh, it's still been a little bit difficult to reach everybody. Um, our We're not able to gather in spaces quite yet. We had at the time a lot of constraints regarding gatherings, so we weren't able to have like town hall meetings, things like that. Getting a Zoom link to everybody, you know, it was done to the best of our ability. But something that's unique about what I was doing is I was still attempting to maintain my position while also working as a liaison between the union and the rest of the staff. So I felt that I was in a little bit better position to try to reach everybody, but there were still constraints that, kept me from fully reaching everybody. So it's been a little bit difficult in that sense to try to get the information to everybody. Um, my colleagues who work on the units still, who are also functioning in this union role, they've been instrumental in getting the nurses' voices heard. So, they'll reach out, and then I would try to amplify the requests as best as I could, from my standpoint. And there were things that were done. There were things that were done. The county was again very responsive to the things that the nurses were asking for. But it's an ongoing process, as with any system and organization, especially when it's under stress. Things do pop up. So it seems like uh, an endless cycle of things that need to be addressed, but uh, they are being addressed. And so for that, those are positive steps forward, I think. Yes, I think the pandemic affected people more than they understand on the surface. And for healthcare workers, and I'm just speaking to healthcare workers at my facility. um, it was kind of the expectation to put your own fears aside to care for others. Um, Nurses and healthcare workers are, I mean, we're used to doing that. But now we know that it's important to provide time for our healthcare workers to process the things they see. Um, and we really need to ensure their safety in the workplace. Um, that's physical safety, that's psychological safety, uh, you know, environmental safety. All of those things are very important, post-pandemic. Um, so for me, ensuring that there is time in my day to care for myself is something that I feel is very important. And I stress that on, newer nurses who may not have that distinction yet. It's not selfish, to take a break. It's not selfish to want to have lunch at the time that you need to have lunch. Um, it leads to our own well-being. And that's something that is critical to attain, you know, in nursing, especially when we talk about holistic nursing. It's all about a balance. So really ensuring that you are caring for yourself before you can care for others. I think that is something that we will see post-pandemic. Um, during the pandemic, for me, for example, I'm a mother of two small children. They're both under 5 years old. And, I found it difficult to navigate the, the pandemic. Me as a healthcare worker, nurse educator, and also my children's father, he is an ER tech. So he bore the brunt of a lot of things, negative things during the pandemic. And we were both very conscious of ensuring that we didn't bring, the virus home to our children. So it was a little bit of an added layer for our family, and other families who are parents of children, doesn't matter what age. It was just that extra anxiety that you had that only added to the stress of the pandemic. So interestingly, early on in my nursing career as an RN, uh, I did experience burnout in, in the sense that I didn't know how to explain it, but I just knew that I couldn't continue, working like this. So what I did to combat burnout in my early years, I decided that I needed a change in environment. Some of my needs weren't being met in the sense that I know this about me. I'm a learner. I love to learn. I love to understand new things. So for me, uh, I felt that I needed to learn more. And so I moved to, a different organization, the current organization that I'm at right now. Um, and I sure did learn a lot. I mean, I was almost considered an expert in my field. I have a clinical background in cardiovascular nursing. I attained my certificate, national certificate in cardiovascular nursing. Um, However, I felt that I needed to understand more. So I applied to Arrowhead Regional Medical Centre, and I became a novice. I became a brand new nurse all over again. Um, and I'm speaking directly to my experience here within the burn unit. So for me, understanding those things about me, understanding that I need to learn in order to grow, allowed me to take that step. Um, and that's how I kind of got out of my burnout, um, by just learning something new. So, I've been there. I've been that nurse who didn't have a routine or didn't have an attention to my own needs. I feel that those times are changing now. I feel that the healthcare field and organizations will try to meet those needs of nurses. But for those who don't have a routine, or they feel burnt out, they feel that maybe they're not able to, get over what it is going on in their career at this moment. Um, for me, what really helped was understanding myself, understanding what are the things that make me happy. So like I said, I love learning. I love attaining new information. So I chose to start all over again, working in a unit that I had no idea, no exposure to in the past. Um, I also, for me in my personal life, I wake up early every morning before my children wake up, and that's really my time to do what I need to do. So very basic things like, washing our face, uh, putting our makeup on, things like that. Those can be routines that you can incorporate into your day that give you that stability, that give you something to look forward to and say, okay, I'm doing this for me. This isn't for anyone else, it's just for me. Um, so really establishing routine is very beneficial. Um, I know it's often said meditation, taking a breath, taking a pause. All of those things to me are very similar. Meditation, in a sense, you might feel that you have to sit there, close your eyes, and not have any thoughts. But really, it's just taking a step back from your current environment and taking the time to listen to yourself and what your needs are in that moment is really important. And so those are just some of the things that I do now um, that really help me get through my days. Sure. So holistic nursing, many people still think and continue to stereotype holistic practices as hearsay, simply because they're not evidence-based, or they haven't been rigorously tested in a scientific setting. Um, Holistic practice and holistic nursing essentially is achieving a balance within your mind, within your body, and within your spirit, whatever that means to you. Um, and really facilitating that not only for ourselves as healthcare workers, but also for our patients and communities. So, ensuring that they have access to well-being, practices in mind, body, and spirit. So I wish I knew that the only items I were able to control were my own actions and not the actions of others. So, you know, for example, you're waiting for a medication from pharmacy and it's due at 9 o'clock, uh, and it's now 9:30. The medication hasn't come up, from the pharmacy yet. Just knowing that I can't control that action, but what I can control is, entering a note stating, I spoke with pharmacist. They stated medication would be up as soon as possible. So little things like that. I wish I had known before becoming a nurse, because I did learn that during my nursing career, but I wish I would have known that before. So, controlling my own actions and understanding I'm not in control of others' actions. Um, I can't control the environment in which my patients, you know, were getting care. But what I am able to contribute is, contributing to the healing environment of the patient by creating a space for them to feel comfortable. So that doesn't necessarily have to be, by giving them, comfy blankets or painting the walls a certain color. It's really just sitting down and ensuring that your patient has your ear, uh, that your patient feels comfortable with you in bringing up issues regarding their care. Um, that's something that I wish I would have had a little bit more knowledge and understanding of before I became a nurse. Um, so yeah, especially when it comes to documentation and charting, uh, it's essential for the nurse to understand that whatever is input into the medical record uh, is official, documentation that if the patient chooses to, they can use that in lawsuits. So it's very important to ensure that you document everything that you see, document everything that goes on regarding the patient. So, the medication example, um, you know, it's important to notate that you took the steps to address the issue appropriately. You may have to consult your organization's policy regarding documentation. um, that's one of the things that is really important for new nurses is to look at the policy of your organization, especially when it comes to charting, to ensure that you are crossing your T's and dotting your I's, so to speak. Now with changes in electronic health record, there's a lot of, there's a lot of shortcuts, so to speak, that make your charting uh, easier, during your shift. Um, but it's really important to add your own note, especially when it comes to, things like a missing medication or any emergency situations. It's very critical to document all of those things. So if you can't find, the area to document that, there's always a function to enter a note, a free text note. So those are some very important things that at least I have encountered in my career. Yes, so I think healthcare workers and nurses in particular need to feel empowered and supported in their roles. Um, in order for this to happen, systems need to be understood and changed to support the frontline staff. um, Carrying out orders of the care team is just one of the functions of a nurse. But, really nurses are the gatekeepers in healthcare. And often that role can be challenged. Multidisciplinary teams really need to understand that disagreements in the name of patient safety should be welcomed and they are necessary for positive change to occur. I really think that nurses, they don't feel that they have a voice, so to speak, in our current healthcare system. Um, Being a part of a contributing part of the care team for many nurses is something that, that they need. Um, we are the eyes and ears of the care team in a 12-hour shift. And if something is observed, or if a patient brings up something to the nurse that they'd like to speak to, you know, um, one of the care team members about, it's important for us to elevate that and to make sure that patients are being provided care. So, really crediting the nurse with the respect that they command with caring for a patient for that long, is really important. Um, Again, a lot that comes up, at least in my organization, and I know other organizations as well, is the pay. Um, you know, Nurses are subjected to a lot of, uh, a lot of emotional trauma throughout a 12-hour shift. And, not to say that that is easily compensated by money. uh, you know, it's it's more of understanding that, hey, this unit, they need more staff, they need more, they need more patient care technicians. They may need more nurses to jump in and fill, some gaps in staffing. That's another thing that has come up frequently, in many organizations, is staffing. A lot of organizations feel that a nurse can fulfill multiple roles, and yes, we can, but that takes away from the healing environment that we provide for our patient. So um, the demand of nurses and their roles is something that I hear a lot about. Just, they need more support staff. They need someone who can watch their patients for the 30 minutes that they take a lunch break, uh, so that they can take their break, and really just disconnect for those 30 minutes. That's something I hear a lot about. So, when we talk about preventing and retaining, you know, uh, we really should speak to the environment that nurses are working in, and the demand that is placed on them. Really examining, what is the function of the nurse, and providing resources like, additional staffing, to make sure that nurses can perform their duties safely. Not just my organization, but, many organizations have been victim to, not victim to, but they've been subjected to looking for staff, elsewhere. And that has come in, the form of travel nursing, contracts, things like that. Uh, there was a time during the pandemic where, yes, our staff, you know, nursing is a very small world, and they would see the advertisements and postings for the travel nurse contracts for our facility. And again, our facility is a critical access, safety net hospital. We can't match the offerings, from a private hospital in terms of money. So, even the travel contracts were not as lucrative as other facilities. So that really has impacted us here as well, because not only have we been subjected to the turnover with staff, um, leaving to take travel nurse contracts, but we also have not been able to attract travel nurses sometimes, which can be a little difficult to navigate, especially for the frontline staff. Not knowing who they're going to be working with that day, or not knowing anyone on the units anymore. I heard a lot of comments like that. Oh, I don't know anyone when I look around anymore. I don't know who's working on my unit anymore. So that only adds stress to the environment. Yeah, so, I really think that it is essential for nurses to speak up, and I just want to thank you for providing this platform for nurses to do so. Um, Also, having a social media presence is beneficial to nursing as a whole. So for me, I'm very active on LinkedIn. You can find me at, www.linkedin.com/Alicia Truelove. Um, there's other ways to elevate your voice. So please do reach out and, feel free to ask me how we can do this as a profession. So again, thank you for your time and thanks.